abdominal pain is one of the most common physical complaints in childhood. Recurrent abdominal pain, otherwise known as RAP in children, is defined as at least 3 episodes of pain that occur over at least 3 months and affect normal activities. RAP is most often considered functional abdominal pain, but an organic cause is found in 5 to 10% of cases. Chronic recurrent abdominal pain is common among children and adolescents. It interferes with everyday life, causes absence from school, and leads to frequent medical consultations, often involving burdensome diagnostic testing and protracted attempts at treatment. Abdominal pain is sometimes a sign of life-threatening disease. It can also have a harmless cause, but nevertheless impair the child's self-perception of health and interfere markedly with everyday activities. Today on your favorite Health TV talk show, The Physicians, we will be talking about recurrent abdominal pain in children. Do stay tuned. It's another day on your favorite Health TV talk show, The Physicians, where your health is our business. Today on the show, we'll be talking about recurrent abdominal pain in children. My name is Dr. Memuna Yusuf Kadri, your regular anchor on the program, and of course with my delectable, amazing, and beautiful co-anchor.
My name is Dr. Martina Agberian. Welcome to your regular Health TV talk show, The Physicians, where your health is our business and will always be our
business. So today we're talking about recurrent abdominal pain in children.
Mom, got a body ache.
Let's not go there. How many times we visited the emergency room with mommy, my tummy, and all that.
How when it's time to go to school?
That is the worst.
In the morning.
Like they've already dressed up, eating. Let's not go there. Then all of a sudden, like, I don't think I can go to school. Then you now call the class teacher. Is there anything at me? Initially, you'll be running up and down. Come, is there anything that is happening in school today? Does he have any presentation? Is there any activity? I say, yes. No, Mrs. Kadri, this is I say, my dear, let's go to school. I'll be in class with you today. There's no need. You know, as a doctor, I will support you. The abdominal pain will disappear.
But you know what, in children, it's usually can be scary.
It's not that it can be scary. It is scary.
Because
they are tiny.
And they'll just tell you, you can't even tell you exactly where the pain is coming from.
They just hold their tummy and then be shouting, it's abdominal.
And is that crying?
It's only crying. Wailing. Rolling, and then you think it's I know, because you are a physician, it's very easy to start thinking of the worst case scenario that if I don't do this now, you know, it took me time to realize that sometimes it's malingering, sometimes they just don't want to.
Something that I also found out is the moment they see that you are taking it very seriously, next time they'll do it again. Just attention seeking.
But again, let's not take away the fact that really recurrent abdominal pain could be life-threatening and something will actually be going on. Absolutely. But again, we have a guest. Let's not let the cat out of the door. But we have a guest who is going to do justice to this topic.
I'm partly excited.
I can feel the excitement. Yes. We'll be right back after this time, and do stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body,
Darabite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darabite from IFEOMA. Darabite, love yourself.
Welcome back. If you are just joining us, this is your favorite Health TV talk show, The Physicians, where your health is our business. With us in the studio today is another beautiful walking encyclopedia. She's no other person than the amazing Dr. EZEOMA, a consultant pediatrician with the Lagos University Teaching Hospital. Welcome, Doctor, for my look so beautiful.
Beauty and brain.
Thank you very much. It's a pleasure being here with you.
Because of this, my babies, when they fall ill, I just take them to you, because when they see fine doctor, they will stop complaining now. They don't will disappear. Because they don't say, doctor is fine.
Thank you very much for having me here today.
Good. Dr. Foma, we are talking about recurrent abdominal pain in children. Let us understand what this means with recurrent abdominal pain, and of course, the causes of why recurrent abdominal pain.
That word recurrent.
Yes.
Okay. Yeah, just like you've said, recurrent abdominal pain is a form of chronic pain. That means that there's abdominal pain that has been recurring, and we have a diagnostic criteria. It occurs when there is more than 3 episodes of abdominal pain, and it occurs in a period of more than 3 months. And also, the pain is so severe, it's really so excruciating and disturbing that it might even affect the child's normal activity. So it's commoner in children between 5 to 15 years, that's childhood and adolescent. And it's really one of the things, if most of referral we have in our gastroenterology unit clinics are usually 40% of the cases that we get. So you can imagine the burden of the disease. It's really something very worrisome. It's worrisome to the family, to the mother. So the mother, of course, no mother wants to see the child going in abdominal pain, just like what you said, you know. So it's so worrisome, and to the family, and it causes a lot of chaos. Recurrent abdominal pain is most of the time is functional. Okay. So what do we mean by saying functional? It could be functional, or we call it functional or non-organic, in 90% of cases, 90 to 95% of cases, meaning that there is no underlying cause, there is no pathology. You know, you screen, you do everything, check everything, and you will not see, you investigate and you won't see anything. But in 5 to 10% of cases, there is an organic cause, meaning there is a pathology, there is underlying disease causing recurrent abdominal pain in such things. So you have to find out what it is, and to do the investigations is really so cumbersome.
Okay.
You know?
So now you have talked that it has both organic and non-organic, functional and non-functional. And for that percentage that's
organic,
maybe a lot of the cases that we see that presents probably fall in that particular category. And it's a huge number as far as I'm concerned right
5 to 10%,
Yes. So what are the risk factors or the possible causes?
Okay. For risk factors for the organic causes, usually it might be an infection, it might be infestation like parasitic infection, hookworm infection. It might be due to peptic ulcer disease, which is really common in children, and it might be due to inflammatory bowel disease, which we are seeing now in our environment. Initially, we thought it was a disease of the developed country, but now we are seeing a lot of that, like Crohn's disease, ulcerative colitis.
Are you serious?
Yes, it might even be something like stones within the kidney or within the gallbladder. It can even be something that is not within the intestine. It might be urinary tract infection, as simple as that. Even chronic constipation in children, you know, can also lead to recurrent abdominal pain. Sickle cell anemia, children that has DKA, diabetic ketoacidosis, most of the time they will present with this kind of bad abdominal pain. So these are the risk factors. Then also some genetic disorders or hormonal disorders can also lead to that.
So this is becoming a bit scary, because Crohn's disease and all those ulcerative colitis. They're not things that were in med school. They'll tell you the moment you see, just say, thank God. Let us move.
So we're going to. That's another thing we're going to discuss.
No, we have to talk about it.
So we need to raise the awareness, because people are not even aware of it. So most of the time, by the time they present, we have complications. In fact, we have the child presented to us at the age of 3-4 years with complicated ulcerative colitis. He presented to us, we are managing now, so it's with complication already. It's not that at that age. So the child has rectovaginal fistula, he has arthropathies, and so it's something we need to raise awareness. You know?
What could, for that age, and I'm sure our audience are also very key, for that age, you will actually think that it will not really come affect a 3 or a 5
Why
year
will you even be thinking of that at that age?
What will have led to that?
Well,
in
if
a
you
child?
see them in younger age group,
Yeah.
and most of them have some genetic
Predispositions.
predisposition. Like some have deficiency of interleukin-10, so also all these immune, they have deficiency of the immune, or some of the immune those cells. So these are the things that can
Or
cause.
could they also be like they have a comorbidity, maybe already existing, or
No,
nothing
most
like
of the
that?
time, if you see them very early,
Early.
it's just a genetic predisposition. There are other things that can lead to that, so environmental causes and other things. So
Such as, because in this environment, especially, let's bring it home, like what
you know
can
what
be
someone eats, you know, the
Okay.
kind of food, some draws can lead to that, you know. So these are the things, but we're going to discuss
children,
that
I think
later.
I think it's best
Something
for
we're
us to
going to-
discuss
yeah.
something really different.
Yes.
And is there any gender bias when it comes to recurrent, or any
well,
male female is the same?
No. It's commoner in girls.
Oh.
It's commoner in girls,
And
right?
it
But
did show.
there is no scientifically we've not found why it's commoner in girls, but
Okay.
most of the cases are commoner in girls. We see in girls,
Girls,
you
okay.
know, and it's,
Women.
just like we said, the school age and the adolescent age group, you know. So these
So
are,
what exactly are the red flags? when you
yes.
have
So
such?
now, red flags, of course, when they come, you have to take a detailed history. So when you're taking a history, you have to find out those red flags,
Okay.
because that's what that's what differentiates the functional abdominal pain from the organic one. Once you're seeing a red flag, that means it's no more functional. So I would like to talk about the functional abdominal. What are the presentation?
Yeah.
Okay.
And we'll now talk about the red flags. Okay.
Beautiful.
So now the functional abdominal pain is like, now from the Rome criterion, we have it's a group of functional gastrointestinal disorders. So it presents as irritable bowel syndrome. So you see a child that has abdominal pain, and the child will be having the pain gets better with evacuation, maybe defecation, or maybe there is changes in the frequency of stool, or the child feels a sense of incomplete evacuation when you get to when you want to use the restroom, or do you understand? So that's one part of it. So we have the functional dyspepsia. You know sometimes you just eat small food and you get so full. You get bloated, you feel nauseated, excessive belching. So this is another form. So sometimes there's another one called abdominal migraine. So that
let's get it. Abdominal
migraine, yeah.
Oh wow.
Yeah, so that comes with a severe abdominal pain when you have headache and have photophobia, so gets bloated, nauseated, and so these are another presentation for the functional one. So now the red flag, as you said, as the child comes and you're seeing a child that is fluttering of weight, is having failure to thrive, or is having recurrent anemia, the child is having excessive vomiting, especially bilious vomiting, and the child is passing bloody stool or even vomiting blood, or the child comes and there is diarrhea with constipation, or sometimes they have arthropathy, as I told you, joint pains, arthritis, and also they have some skin lesions, eye changes. That means there's a problem. So you really have to investigate further and have to be quick.
And exactly, because I think that is where the problem is.
Yes.
If you don't immediately nip on board and know what next to do, then you could just lose that child. Now, what are those things we should also look out for the non-organic?
Okay. For the non-organic, I've already described most of the things they present with, and just like I said, the functional dyspepsia, the irritable bowel syndrome, the abdominal migraine, and all these things. There's things that can lead to all this in children. For them, when a child has some stressful life experience, maybe unstable home, domestic violence, the child has school phobia, he doesn't want to go to school, and it can also lead to abdominal pain for them. The child is being bullied. So these are the things, as physicians, when you're managing them, you have to really get to the roots, get the history well. If you know that this child, it might be a functional thing, what are the things that can cause it? So we have to really look into that for the functional ones. Yeah.
Okay, so I want to just quickly ask now, I just want to understand, at home, a child presents with this very serious abdominal discomfort, pain, crying. As a mother or a father, what should be the first line of action?
Yeah.
The child is complaining about the pain, somehow excruciating, before the child gets to the hospital,
The first aid.
The first aid, what should
have?
And also passing frequent ward visits, most likely. But what should the parent do first?
First of all, the parents should be calm. And
that's difficult.
I know it's difficult, but it's always better to meet a physician.
Okay.
Do you understand? It's always better to meet a physician. You can just give a small analgesia to just calm the child at home. Then you have to present. Don't take any pain for granted or think that the child is having phobia or whatever. So you must have to present to the hospital as early as possible. That's why I say the parents should be calm, also calm the child down, because sometimes psychotherapy can also help. It might not really be that there's something actually wrong. So first of all, calm the child, the parents should be calm, then present to the hospital, give just paracetamol and now present to the hospital.
I think I really like that parents should be calm, because like we spoke before we brought you on board, was the fact that one of my kids had this abdominal pain, and I just called this because he didn't know that I was noticing that he has been doing some certain things to say I'm not going to go to school on the day. So when he said, I called, he said he has an activity to do, and I said, come, I will sit in class, 2 of us, and the abdominal pain disappeared. Imagine if I was like running up and down.
So you have to be calm, and also...
And they will look at you and know that when you are not G2, they will not intensify.
Yeah, because these children are very smart. They are smart, and they play on your intelligence. Yeah. So that's the thing.
And they will look at that loophole.
And then, once they know that they is apprehensive, I say, hey, I'm not going to school, just relax.
That's when they will not watch TV.
Mommy,
I want ice cream and I want the
you need to be calm, know what to do, know your child very well. It's also very important. There's some children that are very manipulative. Know your child very well, but don't take things for granted. As a mother. Always present early is always safer like that.
Great. Okay. So now that we have talked about recurrent abdominal pain, and I will understand that this could be maybe worse than what we think about. What are those things when they eventually come to the hospital? Investigations and the management.
Yes, it's very important. We need to in management has to do with history, which I've already said before. Take a thorough history, ask about the pain. Most of the functional pain usually happens within the umbilical, so we call it periumbilical pain. So when you're having that kind of history, you should know that yes, that is more of a functional than organic.
You're using this word functional, organic.
Okay, that is not a because other people. It's functional means that it's not really a bad thing, or there might not be anything causing it. But in medicine, you can never say never. So, but at least as a physician, when you're getting that kind of history, the sites. So take a good history to give you an idea. Then you now do investigations. Sure. So there are a lot of investigations you're going to do. We have the baseline investigation, and the one you have to, based on whatever you get from your history, you now can do more. So you do a blood test, you check the stool, because I told you about it could be a parasitic infection, check for ova and parasite. You do abdominal ultrasound. You also do a stool for H. pylori. For us pediatricians, we don't do blood for H. pylori, we do the stool. So that's the one that is more specific and sensitive for us. So you check the stool. I also do a abdominal CT. If you do the first line investigation, you don't see anything, because I told you about pancreatitis can also cause abdominal pain, and it's commoner in female. Once you're having abdominal pain that radiates to the back, so you really need to check for your serum amylase or lipase, and so there are a lot of investigations you do, both the blood, the stool, and radiologic investigations. Then also, if you're thinking of inflammatory bowel disease, there is something we'll check that you will call fecal calprotectin. That fecal calprotectin checks for any inflammation within the intestine. So if you're getting that, if you are getting a very high range, you can now do an endoscopy. So these are the investigations you do. Then in terms of management depends on what you get from your history taking, for your investigation that you manage. So if it's a functional, that means there's nothing causing it, that there's no underlying disease entity causing it. That means you really need to, have to counsel the mother, calm them down, and just explain to them that there's nothing wrong from what they what the investigations you do. So that's why you say it's a diagnosis of exclusion. So you have to calm the mother down. Sometimes dietary change management is also important. Maybe take more of high fiber diets, you know. Then also now we are promoting probiotics, and also some people say peppermint, because peppermint has a relaxation effect on the small muscles of the intestine. Then based on what you get, if it's organic cause, if it's peptic ulcer disease, you treat according to whatever you have from the organic causes.
Okay. I like that aspect of if nothing is found, just the mother should just relax and go back home.
But it's really hard.
It's hard.
So you have to really, you don't just tell them, you have to be following them up.
Yeah.
So give them appointments, still be checking, reassuring them. It's really very
It's
hard.
safer that way.
Yeah.
It's better for them to keep coming.
No, they'll keep coming. You just check, reassuring them.
But I would like to know what is going on than saying there's nothing happening.
In fact, it takes a toll on even us for a physician, because they'll come, you'll tell them, oh no, the child is not sleeping, it's not, you know. Although another red flag is when they are not sleeping well.
Okay, so that means it could be.
But once it's affecting the normal activity, but once the child is waking up at night and all that means that it's one of the red flags.
Because just very few parents will actually accept that there's nothing wrong.
Calm down.
They usually
some will take it that way.
A lot.
Yes.
They usually come, so you just keep reassuring them, and you know, eventually you see that the pain goes.
I like it that they will have to follow up.
Yes, you have to follow up.
I like it that way, that they should come, because for some parents, they will just take it on the child.
Yes.
They don't accept anything is wrong with you. Why are you pretending? Meanwhile, the child is generally going through pain.
There are a lot of anxiety.
Yeah, a lot of anxiety.
Yeah.
In fact, I've had to see some cases as a psychiatrist with children with recurrent, and the pediatrician will say, look, at this point, Dr. May, I think you need to see this child. And it could just be anxiety, it could be depression, and
so
you
that's
know,
why it's very
and once you start managing, that just disappears, especially for the teenagers.
Does a lot.
And you don't need, they may not even need medication. It's just psychotherapy. Then you do the family one, because they also need to be reassured. But I think if we go like this, we will go on and on. But we are bringing you back, and please indulge us, because this, when it comes to we talking about children, parents are very attentive, because no parent want to spend money, no parent want to be in the hospital in and out. At this point, yes, we love the babies, but medical treatment and all is always a big issue.
You're actually asking her to go. I wanted to ask her something. Has fried foods got anything to do with it?
Fried food.
Is it fried food only, or maybe junk food?
Junk food, really?
Oh, of course, yeah. Of course, junk food is not good because of obesity and other things. So there's always something. There are a lot of things obesity brings in. You know? So it might, but not really. I won't say 100%.
100%. Once again, thank you very much, Dr. IFEOMA. And for this, we are grateful. And of course, when you speak to babies, we are speaking to all of us, because they are their future, their legacy, and we thank you for helping to take care of these babies. Thank you very much.
It's a pleasure.
To all our viewers out there, you've heard again from a walking encyclopedia. It's not only beauty, but brains. And she has been diving into the recurrent abdominal pain. So as a parent, if you see your child experiencing at least 3 episodes of this abdominal pain within 3 months, that should be a red flag for you to say, look, this child needs this proper treatment. Pediatricians are usually the best doctors to help you out. We are not saying don't go to your general practitioner, but you know, because we are talking about in children, those are the doctors you should really look out for. And of course, we know that there are the functional types, the ones that 90 to 95%, nothing really, even after all the different tests you will run through. But that 5 to 10% may seem small, but it's huge. And so it can impact the life of the child. It can even lead to the death of the child. And if for any reason everything is okay, and they're telling you that you should be reassured and you are still fearful, go back to the doctor, or just speak to a counselor. May just be that the child is dealing with some emotional or psychological issues. My name remains Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
Thank you very much, Dr. IFEOMA.
Thank you, Dr. Martina.
And of course, Dr. Memuna has said this, you're going to come back on our program again. Really
pleasure.
Appreciate your words of knowledge and everything that you have said. I can assure you that most of the parents have taken it very seriously, and they will follow through, especially knowing that there are certain times that you have a challenge, a condition, a health condition that doesn't have an underlying cause.
Yeah.
And recurrent abdominal pain, we find it in one of those ones. So parents, just be reassured. If they tell you that there's no pathology, just go home. Don't get worried. Yes, you are human. You actually can panic, but then the doctor has reassured you. Don't take it out on the child. Don't tell the child, doctor have said, you're okay, why are you pretending? The child is not pretending. The pain is actually there, but we need to now find out why. Reassurance is the key. So just want to follow us on our social media platforms because you are part of us as physicians at home listening to us. Remember to follow us on our social media platforms, on Instagram, on Facebook, on Twitter, and go to our website if you want to be part of this program like Dr. EZEOMA, who is here. Back after. Take care. God bless you.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite. Love yourself.